Hi, my name's Chrys Muirhead. I'm an unpaid carer of two sons who have mental disorder labels. I've also advocated for them in and out of psychiatric settings. As well as that, I'm a writer, activist and campaigner in mental health matters, particularly with a focus on human rights. I want to see mental health acts being implemented properly and also to be monitored effectively. I tend to think that the Mental Welfare Commission is wise after the event. Often it's the people themselves that report things that are wrong, and then the the Mental Welfare Commission goes in after. I really want to see it safe within psychiatric settings for people who have mental health difficulties, because I think that behind closed doors different things can go on. And psychiatric notes are written by nurses and by doctors, and quite often people can say what they like in notes, but I think people should be able to, that are patients should be able to tell their own stories, and it should go into notes also, and the carers should be able to tell their stories, because sometimes the family members will have a different story from the person who has a mental health difficulty. So we need to hear all the stories of the people who use services, the people who provide services, so it's an equal storytelling base, but like a level playing field and straight paths and meaningful involvement. There's too much tokenism and tick box exercises for my liking.
And would it help if people had access to their own notes and they could?
Well, you can eventually get it, but it's quite upsetting reading notes, because my family, we've got access to some of the notes, and I tell you, to read it, it's like reading fiction. And actually, to think, in my son's notes, I've written a lot about me. Difficult and demanding mother. I'm laughing because, of course I was. I'm not going to let them do what they like, lock my son in a seclusion room. I don't know whether you're going to put that up anywhere. But that is no way to treat a human being, to lock them away for hours on end with no toilet. Now, I think that's getting sorted now. I mean, you've got the patient's word against the nurse. Well, they definitely have a seclusion room because they admitted it, and they do lock folk in. So they shouldn't have been. They've been getting away with it for years. And these things have to be exposed and talked about. Mm-hmm. I'm not happy about it. As a matter of fact, I'm quite angry, but then it's okay to be angry. I think to have passion, as long as it's controlled anger. But I think, people that work in different settings maybe get angry and do things to people they work with. And it's called care or treatment. And I think euphemistically it could be people are dominated in all sorts of ways. If the carers that look after them, that's the paid carers, might be a bit frustrated. There's different ways of bullying and having power over people. So I think it's about taking back the power. I've always been a community worker. It's been about empowerment, but now it's about taking back the power.
Okay, thank you, Chrys.